Over 80 Guyanese have been granted scholarships for entry into the medical school of the University of Guyana this year, but the country's premier institution is giving early notice that it will have to turn away many of the eligible and deserving students, including scores more who will be applying outside of the scholarship program. In fact, the newsroom has learned that the medical school, recently renamed College of Medicine, has been turning away between 100 to 150 students on an annual basis because of the lack of space for clinical rotation in the hospitals across the country. What that means is that there aren't enough beds in the country's hospitals to allow for the admission of patients that will in turn allow for studying doctors to have the level of patient interaction needed to complete their studies. With its international accreditation up for review by 2021 having been revoked in the past, UG's medical school is lobbying the government to help retain that accreditation amid a need for expansion of several programs at the master's and postgraduate level. In order to do so, the University of Guyana is requesting that the government move swiftly to upgrade regional hospitals throughout the country by expanding infrastructure and staffing. While not new, the appeal to the government came from Vice-Chancellor of the University of Guyana, Dr. Paloma Mohammed, who was pitched directly to President Irfan Ali at the weekend.
That every single year, we tell students in this country that if you work hard, if you focus, if you study, if you burn the midnight oil, and you do well, we will ensure that you can realize your dreams. And guess what? When they get to the apex institution, we have to say to them, many of them who are deserving, excellent students, we don't have space. You are eligible, you've done well, but the university does not have the space to train you. Mr. President, I want to address this directly with you this morning, because you speak about dreams, and you speak to the young people of this country, and you know what it is like to be young and not to have an opportunity to do what you really want to do. The problem is not only space. The problem is the lack of spaces for clinical rotations in our hospitals.
She said following talks with the Ministry of Health, the university has been able to increase the annual number from 40 to 50 students, but she lamented the fact that this is done while double that number continues to be turned away for a simple issue that can be fixed. In a separate interview with the newsroom on the sidelines of the event, Director of the medical school, Dr. Rita Gobin, stressed that expanding regional hospital would also ensure that communities will be served better, but more importantly, it was also important in ensuring that the school keeps its accreditation. Full accreditation by the Jamaica-based Caribbean Accreditation Authority for Education, Medicine, and Other Health Professions has only been restored in 2017. Dr. Gobin explained that part of keeping that accreditation requires that there are adequate number of patients for students to get exposure before they graduate.
If you have a large number of students and a small number of beds, that doesn't happen. And so accreditation
stipulates that you have to match
exactly
doctors with patients.
You have to have adequate numbers of patients for the students to get enough exposure before they graduate, so that when they graduate they've had experience of interacting with patients. This is why you can't teach medicine online. You might be able to do the theory online, but you have to have the practice.
In order to keep accreditation and to be considered worthy to train doctors, the school is required to ensure that they are doing clinical rotation in a hospital with 120 beds. The government has announced plans to upgrade the West Demerara, Suddy, and Bartica hospitals. Kurt Campbell, Newsroom.